So good afternoon. Welcome to the National Hispanic Council on Aging virtual town hall about COVID-19 and mental health, presented in partnership with AARP. My name is Christine Perez, and I am the Programs and Resource Development Associate at NHCOA. It's my pleasure to moderate today's virtual event. So due to the ongoing COVID-19 pandemic, NHCOA is continuing to develop innovative ways to engage, inform, and listen to the communities we serve. For 52 years, NHCOA has worked to improve the lives of Hispanic older adults, their families, and caregivers. Even during a pandemic, we continue to work towards that mission. So NHCOA continues its dedication to disseminate timely and accurate information while also creating a culturally and linguistically sensitive spaces in which Hispanic older adults, their families, and caregivers can come together to discuss issues impacting their lives. NHCOA also strives to connect Latino older adults with local leaders, advocates, service providers, and policymakers to work towards solutions that address their community's specific needs, and this town hall is one of those spaces. So May is Mental Health Awareness Month, a time dedicated to raising awareness across the world about mental health challenges and acknowledging the importance of maintaining our mental health amidst a pandemic. Today, it's my pleasure to welcome a panel of experts that will highlight what rural communities are experiencing in regards to mental health, the importance of local health clinics like La Clínica del Pueblo that are working with mental health during the pandemic, and findings from the NHCOA's virtual focus groups with an emphasis on mental health. So to begin the virtual event, it's my pleasure to introduce the President and CEO of the National Hispanic Council on Aging, or also known as NHCOA, Dr. Yanira Cruz. She's one of the nation's foremost advocates and spokespersons for diverse older adults and is nationally recognized for her commitment and leadership on behalf of diverse older adults. Welcome, Dr. Cruz.
Thank you, Christine, and good afternoon, everyone. Buenas tardes a todos, and bienvenidos. So I am delighted to be here, and I am delighted to be in such great company of individuals who really care about all of us, who really care about making sure we're all living better and well, and we're aging well. So thank you to my panelists, to our colleagues, to our friends who are here, taking time of their busy schedules to join us. And we're very lucky because, as Christine says, we have a very nice representation of different perspectives. So I think today is the beginning of hopefully a lasting conversation around mental health. You know, mental health has been a challenge for many communities, for many individuals, for many families before the pandemic. But with the pandemic, mental health has become a more prevalent issue for our families and for older adults and for just communities across the country. So, you know, I remembered right at the end of last year, when we were in the middle of the pandemic, one of the residents of our housing facility, our Casa Iris housing facility, which is located in Washington, D.C., Eduardo went for a walk. He went for a walk and he went to the bank. Of course, taking all the precautions with mask, and but he needed to do that. So he stepped out of the housing facility, and just at that time when he stepped out, some of the protests were going on in the city. You will recall that in Washington, D.C., we had protests around the elections, and so one of the participants of the protest just attacked Eduardo, pushed him to the ground here in Washington, D.C. Eduardo ended up in the hospital. And I'm talking about a very tall, strong man. He, of course, is in his 70s. He ended up in the hospital for 8 days. This is all, right in the middle of the pandemic. So, he then returned. Fortunately, he managed to return back to the housing facility to recover. And at the housing facility, he really was just interacting with his caregiver, and he's one of the fortunate older adults who has a caregiver in his home. So the interaction was just between him and the caregiver. So Eduardo is suffering from a lot of depression, from a lot of anxiety, and now struggles with how he navigates a sort of as we come out of the pandemic. We're still in a pandemic. The virus is still there, of course, but some of the restrictions are being lifted, and so he is having trouble coping with the world, if you will. So Eduardo is an example of, I know, many stories around the country, and so I hope that we can begin to create awareness on this important topic, and we can begin to take action. I do want to share that yesterday I had the opportunity to um, have a meeting with some of the senators, and especially those who are interested in aging issues. And other colleagues from other organizations were there as well. And I brought this up to their attention. I brought up the issue of how older adults are experiencing unusual levels of mental health. And so hopefully more attention will be given, more resources will be allocated to this, because we need that. We need more resources for clinics, for community-based organizations, to be able to serve this population more effectively. So I also want to say and just invite all, our participants here today in our webinar, invite you to continue to work with our communities, families, and friends to get them vaccinated. It's important that that in order to control this pandemic and to reduce morbidity and mortality in our communities and in our world, we need to be attentive to this and be responsive to the availability of a vaccine, and take that shot. So we do have a resource that we have set up. The National Hispanic Council on Aging has an 800 number. It has a resource center that can answer all your questions around coronavirus, around the vaccine. If you have any hesitancy, you can call this number, and we'll be happy to answer any questions you might have, or put you in the right direction to get the information. And also, if there's any transportation issues to the location site, I know that that can be a challenge as well. Not everyone has access to transportation or to a car, or not everyone has access to a computer or to the internet. And so we want to be able to be a bridge to that and be helpful. So please take down this number, share it with your community and your friends, and we'll be happy to help them. So with that, I think as we were sharing earlier with the panel, it's a moment to come together. It's a moment to work together, and to think of big and bold ideas that can help us, re-engineer our aging field. We need to come back from this pandemic better and stronger. But some of the things that have been done in the past cannot continue to be done in order to have different results, right? So with that, I leave you in the hands of a tremendous and amazing colleagues who will share their perspective with all of us. So thank you.
Thank you, Dr. Cruz. So our next speaker who will provide welcoming remarks is Ms. Sarah Lenz Luck. She's a Senior Vice President for Policy and Brain Health in AARP's Policy, Research, and International Affairs. Ms. Luck leads AARP's policy initiatives on brain health, and care for people living with dementia, and serves as the executive director of the Global Council on Brain Health, an independent collaborative of scientists, doctors, and policy experts. Ms. Luck also coordinates AARP's role in the Leadership Council of Aging Organizations. Welcome, Ms. Luck.
Thank you so much. It's a great honor to join the National Hispanic Council on Aging for this very important conversation about COVID-19 and mental health. It couldn't come at a better time. At AARP, as you may know, our mission is to empower people to choose how they will live as they age. And the pandemic has put challenges to all of us like never before, just around those choices. But we value our partnership and our collaboration with NHCOA. And this town hall is just another great example of our important work together. And I thank Dr. Cruz for inviting me. But right before this panel started, she was talking about how important it is for us all to join together as community. And of course, the pandemic has really isolated many of us. And so the opportunity and importance of connecting together in community as organizations and just as friends and neighbors has never been more important, and it is especially important to mental health. So thank you for inviting me. As Americans emerge from this pandemic, we are struggling to reassert control over our own health. And this is especially true of mental health. And we're feeling anxiety, depression. We haven't been taking care of ourselves. Our fitness and our nutrition may have gone by the wayside during this struggle. Being forced to isolate and limit who you see and where you go has dramatically changed our routine. And if you've been struggling with mental health issues as you age, it's made it just that much tougher. And even if you haven't been isolated, let's say you've been an essential worker who couldn't isolate, you've had your own stresses and challenges along the way. So at AARP, we're trying to help people reclaim our health and find the new normal, being aware of how you feel and ensuring that you take time for yourself and to be with others that you love is critically important. I wanted to mention that AARP has resources to help people take those important small steps so that you can help feel more in control of your life again. I think that's part of mental health and certainly part of brain health. But I would recommend you go to www.aarp.org/healthy living, because we have lots of tools and tricks and recommendations about assessing your mental well-being, learning about how to find the right therapist. Now, you have the great benefit of today's webinar where you'll hear lots of particular resources in your communities, wherever you may be across the United States. But AARP.org provides you opportunities and things that you can explore to help you reclaim and bring joy back into your life, which has been sorely missing for many of us over this last year. I wanted to say a little bit about the Global Council on Brain Health because we published just a couple of months ago a report on COVID and brain health. It's available in Spanish, both the big thick report and the one-pager, and you can find it at Global Council on Brain Health, all one word, .org, globalcouncilonbrainhealth.org. And we talk about the direct and indirect effects that COVID is having on your brain health. And mental health certainly is one of them. And I wanted to take my last minute just to throw a couple of ideas about how you can help maintain a healthy mental state as the pandemic continues. Make sure you take time to unwind and pick up activities you enjoy. Consider taking up a new hobby, spend time outdoors, take breaks. And now when you're getting vaccinated, you're going to be able to be with your friends and your families and your loved ones without fear of the worst effects of the COVID-19 virus. Staying socially connected, whether it's by teletown hall like this, or through the social media, that's great, but there's no substitute for in-person connections. So following the public health guidelines to keep yourself safe, it's now safer than ever to be with others who have been vaccinated. But basic things like staying physically active, remembering to get good sleep, and exercise, taking a walk outdoors can work wonders for you to help maintain a better mental health approach and to help reduce your risk for cognitive decline as you age. So thank you for letting me share these tips. I know that these fabulous experts that NHCOA has brought together for this teletown hall have incredible information and resources to share. And it's my pleasure to be with all of you, and I'm going to stop talking so I can start listening.
Thank you, Ms. Luck. So we would like to begin this webinar with a poll, which we hope you can all participate and provide your answers. So let's start with the first question. And we will provide all of you, of the attendees, a minute to complete it. The first question is, what is keeping you up at night? So we have several options. You can select one, either depression, anxiety due to the pandemic, finances, all of the above, or none of the above. Okay, so most were none of the above, and others were depression, anxiety due to the pandemic, finances, etc. Thank you. So the COVID-19 pandemic has had a huge effect on our lives and the way we interact with each other. Consequently, the public's mental health has been severely impacted by feelings of loneliness and sorrow. The new normal and the constant exposure to news and content on social media can also cause a deterioration of emotional and mental health. This is true for about 46 million Americans who live in rural areas, and they face distinctive challenges during the COVID-19 pandemic. The long-standing systematic health and social inequities have put some rural residents at increased risk of getting COVID-19 or having severe illness. Moreover, rural communities are also becoming more diverse, and this includes groups such as African Americans, Hispanics and Latinos, American Indians, Alaskan Natives, and Asian and Pacific Islanders. And all these groups have an increased risk of contracting COVID-19. But let's welcome our first speaker, Ms. Josefina Mata. She is the Executive Director of Concilio CDS, Inc., a not-for-profit private organization in New Mexico with a program component statewide. Ms. Mata has experience working with underserved populations and has focused on various national and transnational initiatives. Ms. Mata has over 30 years of experience in administering healthcare, civic engagement, senior corps, AmeriCorps legacy, among others, in rural areas that have been federally designed as medically underserved populations in New Mexico, West Texas, and in Mexico. And all these programs have been focusing on capacity building and equity around hunger, poverty, health, advocacy, and veteran and military assistance, and social justice by integrating an intergenerational approach. So today, Ms. Mata will speak about what the community is experiencing with regards to mental health in rural America. Welcome, Ms. Mata.
Buenas tardes. Good afternoon. Es un placer estar aquí con todos ustedes. Thank you very much. It's a pleasure to be here with all of you. I will first like to thank our partners at NHCOA, Dr. Yanira, Cruz, and her team for providing forums such as these that are crucial for our Latino populations. And can we go to the first slide, please? And so today I will be briefly discussing the populations that we serve, the Latino, Native, people of color, seniors, low income, and the challenges that they face, especially during the time of COVID-19, and how through maintaining and strengthening our community connections during this period has made our communities resilient in such a difficult and turbulent period. During the time of COVID, the rural community challenges that our communities were already experiencing prior to the pandemic were transportation, being federally designated as medically underserved, and experiencing higher rates of chronic conditions. Additionally, with stay-home orders and social distancing in place for the protection of our high-risk and vulnerable populations such as seniors and those with underlying conditions, made it difficult for families, particularly multi-generation households and tight-knit families, to take care of one another across state lines or across the US-Mexico border, such as receiving medical care in areas that were considered high risk, COVID-19 hotspots. An example, families that live in Western New Mexico but having their primary care providers in Arizona, or for our seniors living in Southern New Mexico, relying on their families who live across the border for transportation resources that they would normally attain in El Paso, Texas, thus creating high stress, fear, and anxiety with our communities. Therefore, maintaining the physical and mental health for all of our community members was a top priority for Concilio, for our organization. Next slide, please. Our first priority was to communicate with our staff, our team, volunteers, community leaders and their families with the public health orders and the methods in which they could protect themselves with families, and by doing so, protecting their communities. Moreover, with an overwhelming influx of information from the news networks and other media channels, it was important for us to ask how each person was feeling and listening to their concerns during the pandemic at the start and during this time. Reassurance was provided through phone calls and assisting with the delivery of basic and essential needs, providing translated into Spanish printed material that early on during the pandemic was not readily available for our Latino populations. Furthermore, providing ongoing support with fear, isolation, and loss, as many families experienced drastic changes that disrupted their way of life, where due to protecting each other, they became physically isolated, and experiencing loss of a family member or friend was more difficult to cope during and manage, which is why supporting each person's social network was crucial as we as a nation faced the start and spread of the COVID-19 virus. And through our intergenerational approach to services, volunteers across all ages supported one another in providing information and staying connected by assisting with vaccine registration, transportation to vaccine sites, and providing or coordinating the transportation to the vaccine sites. They also were sharing artwork through the mail created by their grandchildren or others, or making meals for their neighbors and friends and family. Capacity building for supporting the mental health of our communities was done through establishing goals and priorities for each individual. such as maintaining their normal schedule by eating their daily meals, as many due to high stress begin to fall off their routines. Moreover, promoting exercise at home to maintain fitness and prevent the loss of mobility, especially among our seniors and low mobility populations. Additionally, encouraging rest and maintaining regular sleep patterns was also important. The mental health support training and resources that were provided to the populations that we serve, the American Red Cross, Be Red Cross Ready, Prepare as You Protect, and empathy training. Studies have shown that empathy recognizes that all individuals experience life and circumstances differently. Therefore, all individuals have been experiencing the COVID-19 pandemic differently, and each have a unique and different way in which they can provide support to one another. Moreover, our staff, our team, volunteers, and community leaders took to their toolboxes of previous training and utilized their skills to support their communities through best practice programming. Our volunteers, have been trained in various evidence-based programming such as Cuidando con Respeto, the Savvy Caregiver, to provide, caregiving support for those who, with Alzheimer's and other dementias. They have been trained with chronic disease self-management and other trainings for caregiver support and self-care during COVID-19. And during this time, the information and education that they have gone through, they were able to utilize all this best practice programming that they have gone through before themselves in order for them to educate others and by then, assist others with their mental health and physical health. And as you can see here, on the left-hand side, that's some of the self-care assisting that we were doing, for all of our volunteers. So again, thank you, very much for providing us with an opportunity to present, what Concilio has been doing, during this time of COVID, and what we're planning, as we're coming out of the pandemic, is what Dr. Yanira was saying, to become, better and stronger, and to provide our families, especially in our rural communities, with the resources that they need. So thank you so much for, for inviting me, for NHCOA and all of our partners, and again, I look forward to hear our other expert panelists during this forum. So thank you very much.
Thank you, Ms. Mata, and thank you for your work and also the work that you're doing in the rural communities regarding with mental health. So again, I want to remind all of our attendees that if you have any questions or comments for our presenters, please type them in the chat box and we will address as many of your questions as possible during our question and answer session. So before presenting the next panelist, we want to present our next poll. And the question is as follows. So what psychological support would you like to receive in your local community? So please select one, and we will provide 1 minute for you to complete it. So we have several options. It can be, if you like, virtual group therapy or individual therapy via phone or written information. Okay, so we have, a mix. It will be all of the above. Like in virtual group therapy, individual therapy, and written information. So thank you all for participating in the quick poll. So as a nation adjusts to getting everybody vaccinated against COVID-19, the risk and impact of the pandemic will remain high for many at-risk individuals, particularly those with access and functional needs that rely on social services and home and community-based services. They all play an essential role in helping these people obtain critical services and support by allowing them to adjust to the COVID-19 era. So community-based organizations are resource hubs that provide specific services to the community or to a targeted population within that community. The audience for this resource includes national, state, and community-based organizations, human social services providers, low-income housing providers, community health centers, such as La Clínica del Pueblo, and other leaders in similar settings who are responsible for developing and putting into action care continuity policies and programming during and after COVID-19. So let's welcome our next speaker, Dr. Suyana Linares Barker. She's the Interim Chief Programs Officer at Community Services at La Clínica del Pueblo. And Dr. Linares Barker is responsible for overseeing the design, implementation, and evaluation of programs that are culturally and linguistically grounded. Her portfolio includes oversight of the Community Health Action Department and the Health Equity and Language Access Initiatives. She also oversees our La Clínica's monitoring, evaluation, and reporting systems and program development to reduce health inequities that affecting the local Latino community. So today, Dr. Barker will speak about the importance of local health clinics like La Clínica del Pueblo, working with mental health during the pandemic. Welcome, Dr. Barker.
Thank you, Christina. Thank you, Dr. Cruz, for the invitation, NHCOA. It's a pleasure for me to be here. And I look so much younger on this photo. I think it was pre-pandemic, right? We all look better before this pandemic. But I think we get wiser too, right? I think being one thing that we learn with passing through time and also passing through adversities, we get some wise and we learn something with this challenge. And I'm here today to share with you all a little bit what I've been learning at La Clínica. For those who doesn't know, La Clínica is a federally qualified health center. The next slide, please. La Clínica was funded in 1983, a volunteer-based clinic that was set up in DC to help the first Salvadorian immigrants that came to this area due to the war in El Salvador. We're still serving, majority of our clients are from El Salvador, and due to other crises, also environmental crisis, we have the migration from the Central American coming to DC, and La Clínica is one of the service providers here that was set up to serve and to incorporate the El Salvadorians into our social fabric in DC. In '95, we were incorporated as an independent non-for-profit 501c3. And in 2007, we become a federally qualified health center. So in 2 years, we're going to be 40, and we think we're becoming mature enough to understand a little bit what we do. So La Clínica's mission is to build a healthy Latino community through culturally appropriate health services, focusing on those most in need. It's important to mention that because I'm talking today about serving the most in need. I'm talking about any community, right? We're pretty much the service provider, the health provider for those who are really left behind many times on the system that's set up even in the capital of the US, right? So we believe that healthcare is a human right, and we have that as a vision, how to make sure healthcare is for everyone. Healthcare is not a privilege. Healthcare is not a right that you get because you work. Healthcare is a human right. Every single person should have access to healthcare, and we do a lot of advocacy to ensure that. And our values is our health equity, community, quality care, perseverance, enthusiasm, and collaboration. To give an idea of this, it's a little bit what we call the people who need us, right? People who need us are those who are not only immigrants, but they are uninsured or not enough. The insurance that they have is not enough. They live 200% below 200% of the federal poverty line. And we are in what we call DC metropolitan area. If you are not familiar with this area, we have two states that are really close to DC, that's Maryland and Virginia, and we serve the metropolitan area, DC, and some counties in Virginia and Maryland. La Clinica has a combination of 4 main areas of work. Next slide, please. We have the primary medical care. This is a service provided by doctors and nurses in care teams that include also all of us, right? I mean, around the medical team is all La Clinica in some ways. We have a mental health and substance use department that has 2 special programs. One is a substance use program called Por Vinda Vivir, and another program that's a school-based mental health program called Mi Refugio. We also have the Community Health Action Department with 3 programs in special, Entre Amigas, with a gender-based or domestic violence prevention program. We have Empoderate, which is a LGBTQ affirming program, and our Promoción de Salud, our health promotion program that is for the whole community, right? It's not a specific group. And we have a health equity department that is promote our language access program, our medical interpretation program, but also runs our advocacy campaigns, like one that we call Salud Sin Barreras. We have 4 locations. We are in DC and in Maryland, in Hyattsville, is a city in Maryland, on the Prince George County. And we have 2 sites that are not clinical. One is called La Casa, also in DC. That is a facility that's like a welcoming center. And from this welcoming center, we navigate people for different services and even inside our clinics if there is a need for that. And we have the Mi Refugio, which is based on a high school in Prince George. The core elements of La Clinica work is high quality, culturally sensitive, patient-centered, trauma-informed care to uninsured and underinsured patients. So it's very important to, because everything that I'm going to say later to you has to do with that. We integrate and co-locate services. So if people need to go to a doctor, talk to a therapist, and also see a health educator, they can be done in the same location. So you don't have to go to different locations to do that. We coordinate primary care, mental health, and peer-based education. So we have all these community members work with our care teams como promotores de salud. And we have the health action department that goes beyond the clinical space and creates safe space for our community to come ask questions, even if you don't know if you need a doctor or not, if you're a therapist or not. Those safe spaces are open space where everybody can come, talk to us, and we help to assess what you need. We have a health equity, language access, and advocacy component because serving the most at need, immigrant, limited English to speak, we have to have those initiatives to make sure we include everybody. To talk about this pandemic and mental health, it was important for us to show to you that what we think about health, right? We think about health as a combination of it's like is that complex interplay, right? Biological, psychosocial, cultural, and spiritual construct. You're not healthy if you're not talking about health only about a body, but you talk about a component of many different components actually to make you healthy. What we see in our community is if there's too much stimulation, like if you try to suppress your own culture to become very much American in a sense of being disguised, not wanting to be close to your culture, just to become more look like what day-to-day life in America is, you have more chances to have problems. In the opposite, if you can learn how to live in this country, if you can learn how to do with all the opportunities and possibilities of the North America, at the same time that you maintain their own culture and you adapt to it, maintaining those 2 things together, you have more resource to do with any kind of disease. So in terms of what we think about health, health is our capacity to deal with problems with strength. Problems we're going to have, we need to have strength. This pandemic asked for a lot of strength. And what we saw initially was that those who could use their own cultural support, spiritual support, had more strength to deal with this pandemic. And then others who felt very disconnected and could not feel that they were protected in this environment. The lack of protection in this environment has a combination of isolation, unemployment, eviction, precarious working condition, food insecurity, and violence. People living that and not having support for that end up having much more stress, anxiety, fear, sadness, and loneliness. So it's important to think about this, because when you think about suggestion, how people would be stronger, we could not just give people advice on something that they would not have capacity to do, right? We tell people, eat well, because you're going to be less anxious during the pandemic. If you don't have food, you cannot eat well, right? If you don't have access to food, you're not going to eat well. So in order to find out how to help people, we use a lot of empathy. And this has been we call this empathy as a remedy. We had to, more than ever, put ourselves on people's shoes. More than ever, we need to understand people's values and needs, not from what we thought, but what people are telling us. We need more than ever call people home and really ask people questions to them to describe well their reality, and not be judgmental to their reality, not blaming them more than ever, and more than ever understanding that solutions that we have to them may not be the solutions they can implement, because they're living such poverty or with such fear that we could not imagine. Some people are not fearful of getting the virus, people are fearful of being evicted or not having what to give to their family to eat. So this was very important for us. And also use all that we learned with this empathy of calling people or trying to understand what was going on. More than ever, we start creating some educational materials to attract people to us so we can be a resource to them. Our educational materials, we adapted from other things that other people are doing. Of course, all of this is common sense for a lot of us. We saw this, but we want to have La Clinica brand on it. So La Clinica could be a place that people would feel and be wanting to call. And then we become receiving, I mean, in a period of 2 months, we get 29,000 calls of people wanting us to help them to find solutions and to feel comfortable of asking us to help them to find solutions for the day-to-day. So just to summarize, what we've been learning is, for some people, this pandemic hit it much harder than we thought. And some people that could not have the combination of feeling integrated in the society had less capacity to face this pandemic, and then they face more mental health issues. Thank you for your attention.
Thank you, Dr. Barker. So before presenting the next panelist, we have another poll, and it goes as follows: like, what other resources regarding mental health will be helpful for you? So we are providing less than a minute for you to decide. So we have several options, and it goes like more virtual events about mental health, a helpline about mental health, or more information about mental health. Can be via blogs, interactive videos, fact sheets, etc., or other. And it will be great if you can specify in the chat section. I think we are good to know the results. Let me check. Okay, so we know that most of the attendees would like to receive more information about mental health via blogs, videos, and others. Thank you so much. So it's a fact that the coronavirus is still causing major interruptions to our lives. And this disruption, coupled with the threat of contracting this potentially deadly virus is leading many people to experience anxiety, stress, and depression. Based on evolving data, it is becoming increasingly clear that the COVID-19 pandemic is dramatically impacting Latino communities, our most vulnerable, that are especially the isolated seniors, immigrant communities, Latino families, and small Latino-owned businesses. The disparate impact COVID-19 has had on these groups further highlights the existence health inequities that are born out of systematic and structural racism that has existed for centuries in the United States. In an effort to understand Latinos' knowledge, attitudes, beliefs, and behaviors regarding the COVID-19 virus and its vaccine, NHCOA is holding a virtual focus groups around the country. Based on preliminary findings, most of the younger participants, and this includes both COVID-19 survivors and not, reported being in fair physical health, but older participants suffer from hoarseness, troubled breathing, body pains, and weight loss as a result of the virus. All participants report the pandemic had a significant impact in their emotional and mental health, as the fear, confusion, and uncertainty of the early days of the pandemic compounded financial struggles, social isolation, and stress from confinement. But let's hear more from our next speaker, Yvonne Rivera, who has over 15 years of experience in qualitative research design, development, training, evaluation, and implementation. Yvonne's consulting practice focuses on providing services to organizations in the design and development of focus groups and key respondent interviews, intercept interviews, diets and triads, cognitive testing interviews, evaluation, job lungs, and quantitative community surveys. So Ms. Rivera has worked extensively with the African American, Ethiopian, Asian, and Latino communities in the DC metropolitan area and nationwide. So Ms. Rivera will speak about the findings from the NHCOA's COVID-19 focus groups with a focus on mental health. Welcome, Yvonne.
Hello, Christine.
Yes, you can go ahead with your presentation, Yvonne.
Thank you, thank you. And do you have my first slide, please?
Yes.
Thank you. Well, we have some preliminary findings. We conducted various focus groups virtually in the different areas, Washington, D.C., Montgomery, and Prince George County, in Maryland, New York City, Los Angeles, Houston, and Puerto Rico. So during our focus group discussions with Hispanic adults, we have observed that mental health has been significantly impacted during the COVID-19 pandemic in several ways for different population groups. The general observations from our participants highlight that mental health has been overlooked as an area of major need during the pandemic. As we recover from the pandemic, providing these mental health services will be essential to building back the social fabric. Next slide, please. Our participants reported experiencing significant fear and anxiety at the start of the pandemic across all age groups. Many describe it as a nightmare due to confusion, lack of resources, lack of information, and uncertainty about the future. There was an initial fear over their own health and well-being, and that of their family members, both in the United States and in their country of origin. As more and more people started to contract the virus, many reported feeling abandoned and helpless, as they were often turned away from hospitals and had to work out impossible logistics of isolating themselves in homes where they lived with large number of people or were even discriminated against and evicted from their homes. For many undocumented immigrants, there was also an additional fear of even seeking out care, in fear of being penalized or deported, and many of who had the virus never got tested or received any medical or government assistance. Next slide, please. Even more, the loss of loved ones and the high death toll from COVID was very difficult for some participants. One participant reported a death of 23 people in her social circle alone. The kinds of losses participants reported were sudden and frequent, which made them difficult to process. Others reported the sadness of losing loved ones in the US or other countries whom they were not able to say goodbye to, and whose bodies were not given to the families to properly grieve, and whose locations are not even certain. Next slide, please. Another major source of stress and anxiety for many of our participants was the financial impact of the pandemic. Although many reported that they continue to work as essential workers and community activists all through the pandemic, many others bore the financial burden of unemployment, closures, and restrictions, especially in the food and service industries. For these people, the inability to provide for their families and the debt they accumulated through the pandemic is a stressor that continues to affect them, even those who have slowly started to recover. Next slide, please. Our focus group also showed that the stay-at-home orders and quarantines were particularly detrimental to the mental health of some groups, including the elderly, children, and victims of domestic abuse or substance abuse. In one of our groups, made up of elderly adults in an independent living facility, we heard a lot about the disruption of the social interactions with their loved ones and their fellow residents as a sort of depression, weight loss, and anxiety. They were keen to express the need for mental health services to be provided for individuals and groups that dare to learn how to cope with the isolation and the new normal. Next slide, please. Parents also mentioned difficulty in adjusting to the stay-at-home orders. One participant reported having a hard time with postpartum depression without the appropriate access to support from her providers and the stress from watching the news and uncertainty of the future. Parents of students also said that they had a hard time adjusting to virtual education, often for more than one child at a time, and many of their children felt confused and sad, and often had trouble focusing on their classes. Finally, women and seniors who were victims of abuse, foster children, and substance abuses were also highlighted as already vulnerable groups whose mental health suffered significantly throughout the pandemic. As mental health and social services became secondary to medical and prevention services, the physical and mental safety of these groups was forgotten, and some of the social workers and community activists in our focus group mentioned having to intervene in suicides and domestic violence episodes without the proper support. Next slide. Our participants identify themselves as members of a Hispanic community that thrives on social interaction and strong ties with family and friends. Many reported feeling a loss of freedom and a loss of meaning with all the closures and restrictions. Participants mentioned they had to actively seek out new ways to socialize and interact with their social circle and relied heavily on community services and networks to cope with the pandemic. But they recognized this was not a possibility for many people who are alone in the country or whose immediate circles were not as strong support. Next slide. Although mental health was a major topic of discussion in our focus group, most participants did not seek out mental health services during the pandemic and did not feel these were available or sufficient, such as 15-minute virtual sessions where prescriptions are refilled every 2 weeks. Community leaders and social workers reported needing mental health services themselves, along with medical providers and other essential workers who have had the difficulty of job of supporting their communities while processing their own experience with minimal support and resources. Participants express a still feeling uncertainty that things can truly get back to normal, fear over this or the next pandemic, and stress from the financial and emotional burdens left behind by COVID. They consider it essential for mental health to be prioritized as the nation works to rebuild and repair. Next and final, participants consider it essential for mental health to be prioritized as the nation works to rebuild and repair. Thank you.
Thank you, Yvonne, for providing the findings, well, the preliminary findings of NHCOA's focus group. So again, I want to remind all of our attendees that if you have any questions for our presenters, please type them in the chat box. So before ending our panel session, we have a final question for you. And again, we will provide you a minute or so to complete it. So the question is, where do you prefer to receive information to improve your mental health? And here you can select one. It can be social media like Facebook, Twitter, Instagram, radio, brochure, or local media outlets. So here we have the social media. So it will be via Facebook, Twitter, Instagram. So thank you all for giving your feedback. So let's begin with the question and answer session. And again, for all of our attendees, if you have any questions for the panelists, please write them in the chat box. So we have several, and this will be in general for all the speakers. And it goes as follows. What were the main challenges when providing mental health support to your constituents?
Yeah, I can say that. I mean, one thing was really privacy at home. When we have the necessity to everyone be at home, some people didn't have enough privacy to talk to their provider in their home. We had this challenge with women that sometimes the amount of work that they have at home and also the responsibility of taking care of everybody, they didn't have enough privacy. There's one thing. The other thing that we had was really, for some people, the bandwidth to have a telehealth. They would have capacity to do on the phone, but they would not have the capacity to do on video because this would be so expensive. And then the connection is not the same, right? I mean, it's tough to sustain a session over the phone only. And basically, how to recreate the way of doing that. And we had to learn how to do group sessions and motivate people to participate in a group session, virtual, that we didn't have any experience. So there was the other challenge to train staff to do this properly. And we feel very fortunate that our staff was so committed to learn very fast and do whatever they needed to do to help people.
Thank you, Dr. Barker. Josefina, I don't know, AARP wanted to provide some feedback on this question?
Yes, well, with some of our challenges in providing mental health, it was having the resources at the beginning, at the start and during the pandemic. But then as we were obtaining, information on how to access some of the services, we were referring, some of our volunteers and community members to professional services. But as well, it was the challenge of, providing the information of those who did not know that they, that they were needed, those resources, but that we knew that they were going through some, and they needed some grief support. So doing that, through our volunteers supporting each other, helping each other through the telephone, because that was our mostly way of communicating, with our, community. So it was a lack of technology, but we know that that one of the main reassurance was through telephone, making phone calls, to provide even that, just the basic support, reassurance calls. So yes, there were many challenges, but we also see that we had many ways of connecting to our population, especially in those rural communities. Thank you.
Christine, I'll just say that at AARP, we saw so many challenges amongst our members. And because I work particularly in the brain health space, we saw so many challenges for the Hispanic community, particularly dealing with loved ones who had dementia, and tough choices that they had to make while taking care of children and working, and how to deal with their loved ones when facilities closed, adult daycare centers closed, when nursing facilities locked down and you couldn't be with your loved ones. And people with dementia, frankly, were the hardest hit for COVID. And now we have the records to show for it. But especially early on, when we had no idea how long this was going to last or what we could do, the anxiety and the tragedy of people not being able to be and give the love and services that they normally do. We were at AARP fighting to show that caregivers were not optional. They weren't just visitors. They were providing incredibly important services. And to see families torn apart by choices of if they had to work versus care for their loved ones, and there were just no one available. And then many people work in essential businesses, and so they would be exposed and didn't have the options to isolate and protect their families. So the agonies of these choices were terrible and continue to be terrible without having sufficient PPE and some idea of when this was going to end. So I know that trying to provide resources, and AARP went into overdrive to provide COVID-19 information and try to separate out the facts from the fears, and providing unemployment information. And I don't know if you guys remember, but so many people who lost their jobs couldn't get into communication with, labor offices across their states. And there were so many financial, emotional, medical challenges, and people are just digging their way out. You can put up with something for a little while, even a long while, but when it stretches into a year or more than a year, it's a very different kind of thing. So I would just say, as Dr. Cruz mentioned, we're not out of the pandemic yet. And so we're still in the fighting mode of how are we going to build back and build back better for the future, but have to deal with the problems that still exist right now.
I agree. And also with the misinformation that it's out there around COVID-19, and now it's vaccine. So it's much harder for community-based organizations and other national organizations as well to work on this ongoing pandemic. So I have another question, and it's open to any of the panelists. And can anyone share tips to help improve the mental health, particularly of older adults, but from a distance in a virtual way?
Well, for us, at Concilio in New Mexico, basically what we were doing, especially with our seniors, it was like basically over the phone, mostly, when we did essential deliveries, it was like with no contact delivery. But all the support that we did was basically over the phone, even just like very basic guidance and education and, even promoting the healthy eating, making sure that they will keep with their regular routines, making sure that if they were waking up at, certain time that they will continue to do that, so they will be their immune systems, will continue to improve. And also, we were also recommending, promoting regular exercise. Many of our seniors, they were just staying at home, and it was like, simple exercises as in chair exercises, breathing exercises. And that's what we've been doing over the phone. The team, the staff, and other volunteers teleserving, helping others, helping their neighbors, helping their family member, meditation, helping them, meditate, even just over the phone. Let's do some breathing exercises. And one of the main things it was that because of the fear and anxiety that has been happening and has been really affecting our seniors' mental health, we've been emphasizing on making sleep and rest a priority for them, because we know that they need that in order to continue to be healthy. And something that has really been helping with our mental health, with our seniors and all of our volunteers, has been practicing gratitude and empathy. They have been there for one another. And I think that building those social connections, that's something that we need to continue to strengthen. And for us, it comes very natural with our culture, in our Latino population, looking for each other. But I believe that strengthening those connections will continue to help us, all of us, come out of this pandemic and be ready to be ready for the recovery of what's next after this.
I agree. And I'm so happy to
And
hear all your
I
work,
would
Josefina,
add only-
in this effort.
I would add only, don't give up, right? Because sometimes, because people, we call and they complain and they have only sad news to share with us. Sometimes we are sad too, we have sad news. So I think there's a tendency sometimes that we just postpone calling or leaving for later. So I think if you're really connected with an elderly person, just keep calling, even sometimes to listen, right? Sometimes you don't have anything to say to help on that list of problems, but the call in itself is a connection and makes a lot of difference.
I agree, and it's true. So I have another, oh, go ahead, Dr. Sarah, yes.
Just wanted to mention AARP set up something called AARP.org/friendly voices, where we have volunteers calling community members and asking if you just want somebody to talk to, if you're feeling frustrated, isolated, or lonely, either to volunteer or just to have somebody to talk with. AARP Friendly Voices is a great program. And I want to say that looking for the silver lining of the pandemic and finding ways to connect virtually, music is a wonderful opportunity that has really resonated with the Hispanic community. And I know AARP has done a lot of music programming all throughout the country, where we have events open for free, celebrating Latin music and in fun, engaging ways. And so I invite people to check out some of the fun things where you can join together and connect socially by singing together, by listening or participating in concerts. And I can tell you some of the virtual dance concerts have been the most fun activities during the pandemic, and we never would have done it but for that. And we've made lots of great connections and found good ways to let off steam, dancing and engaging with friends.
That's excellent. And I have a question, Sarah. And you mentioned about the friendly voices. Do you know if they have it available in Spanish or any other languages, or just in English for now?
It's a great question. I think it is available in English only, but it's dependent on volunteers. So my guess is we have some Spanish-speaking volunteers. So I'd be happy to follow up and find out and provide that information to you.
That would be awesome for us to share it within our networks as well. So I have another one, and it's what advice well, this is open again for any of you. And it goes like, what advice do you have for improving mental health in older adults living in multi-generational houses?
Well, this is what I heard during my focus groups with several projects is how, you usually as Latinos live in multi-generational families, and I heard that they do art crafts together and that they also cook together. And when possible, they walk together if, the elderly adult is. But that's something I heard in my focus groups.
Thank you, Yvonne.
We also advise, especially the women, to go for a walk alone and empower them to get out a little bit of the task. We are seeing that a lot of the older adult, the women older adult, is in charge of a lot of responsibilities on the house, and sometimes don't have any space to even a little privacy or a little minute. And I think as culture, sometimes we are kind of afraid of doing things alone or in ourselves. Or so in some of our group activities, we empower them to find a space for them to just take care of themselves. Don't take care. They listen a lot of that they should take care of themselves because of the family. And when everybody's with you all the time, it's just like, I'm doing as much as I can here. So can I?
Like, I need a break.
I know. And how to do this without feeling guilt, right? How to feel that without feeling that you're like a selfish person that doesn't want to take care of others. Like, we take care of others all the time as culture, right? I mean, naturally we take care of others. So we should not be afraid of taking a little break
Of ourselves.
and go and do something for ourselves. I think it's important to mention that the caregivers, the women has been hit harder, and our culture put a lot of pressure on us to be the caregiver, the person who clean, who cook, who makes sure the kids are calm, and it's a lot, has been a lot. And usually the oldest person in the house, if the person's healthy, and entre comillas, ¿verdad? Get a lot of the work, has to do a lot of work. So let's find a way for those women to have time to themselves too.
I agree.
And
Yeah.
yes, and for some of our communities, during the pandemic, many of our families, they came together, to live and spend time together during the pandemic and look for each other. And we have been noticing, especially in our senior population, that they have been spending time with their grandchildren, spending more quality time with their grandchildren, and they've been kind of showing things that maybe before they did not have the opportunity for other reasons. But we have seen that many of the grandparents had been showing their grandchildren to cook, to crochet, to do different things that, sometimes some of this type of arts and this type of activities were lost because of, more time, not having, the same schedules or living out of town, or etc. But we've been seeing that the grandparents focusing on providing, some education for their grandchildren, and their children also providing an opportunity for the grandparents in showing them how to text, a very simple text. That was very, helpful for all of us, during the pandemic, because they were, taking time, together during those times. So yes, definitely utilizing, time also to learn from each other. I think that that's something that we saw, that we know that was really helping with the mental and the physical well-being of our families.
Excellent. Thank you. And I have a final question, and it is like, it's from, I'm not going to say the name, but the person mentions that she has a lack of access to technology, and it has been a problem to access online resources regarding mental health and COVID-19. So any of you can mention like any other opportunities to have access to that information that's not necessarily available, that they need technology to be informed. Do you have any suggestions?
If this person has any community health center close to their home, I think there's always the health centers, they didn't close altogether, right? They restricted some of this, but I think it would be interesting to see if there is the network around. I mean, a lot of things that was pretty close last year's open up with some restrictions, but still open up. I think try to get those connections back, like the in-person connection back. I think that we're getting better and probably safer if it's in an urban area like we are, right? I don't know exactly where the person may be. Maybe I mean, is not. Sometimes you don't have something on your corner that you can go and get it. So you need sometimes technology or communication information. Also radios. I think there's some information that has been good in some, at least also in some metropolitan area. Information has been, we are trying to broadcast as much as we can.
Yes, Sarah.
So this is an issue that I'm very familiar with, and so I invite people to call AARP. We have a toll-free nationwide number, 1-888-AARP. The number is 1-888-687-2277. And we have a toll-free Spanish number. That number is 1-877-342-2277. And ask the friendly operators for advice about getting information about mental health, and they will be more than happy to help.
Thank you, Sarah. And Josefina, particularly in rural communities, what do you recommend on these cases or that you have been working in?
Well, something that with no technology, that's basically how we have been working with no technology, with phone only, printed material. That's something that we have been, utilizing for dissemination of information in regards to mental health or COVID, safe practices, but as well as calling your local health department, calling your local health department, in any state that you are, they will be able to connect you with a mental health resource line, where you can call in English and in Spanish. That will be the closest resource through the phone. And of course, make sure that you contact any other partner. You can contact the school district. You can call any other agency, and they will be able to provide you with the resources of local services focusing on mental health and other resources for rural communities. And that's something that has been very helpful for us.
And Josefina, in that instance, what do you think we can do in rural communities to address mental health? What will you recommend?
Well, I would definitely would recommend to bring the resources, but bring the resources, in to the language that it's needed. For example, in New Mexico, to bring resources, in Spanish, printed material in Spanish to our native population in their native language. Having those resources will be very helpful. But one of those things, it will be even before bringing the resources, providing access to transportation, to resources, to places where they can access mental health by providing transportation, providing as well as technology, that will be very resourceful for telehealth, for mental resources, that they will be able to have someone that they can access those resources for them. But make sure that it's in the language and connected to the community and connected to the people that might not watch TV because they work, almost 24/7, and people that might not have regular basic needs within some other communities.
And connecting with community leaders that know their community best. or promotoras de salud, or community lay workers, or health workers.
All kinds of volunteers. We have volunteers throughout, throughout our rural community. So making sure that you connect to those community leaders. That's great.
Excellent. Well, thank you all. And we just ended the question and answer session. So again, thanks to our expert and attendees for joining us for today's virtual event. For more information about today's event and our upcoming events, please visit our website and social media channels. You can find us on Twitter, Facebook, and Instagram using at NHCOA. And a recording of this town hall will be made available on our YouTube channel. So again, it's everybody's duty to work towards stopping the spread of COVID-19 by complying with public health guidelines such as getting vaccinated, wearing masks that cover your nose and mouth, and practicing physical distancing and washing your hands. Let's be agents of change for our families, friends, and older adults, our communities, and the world we live in, and for ourselves. So hope is essential in times like this, but let's remember that you're not alone, and together we will succeed. So the heart of NHCOA goes out to each of you. Thank you, gracias, and until the next time. Goodbye. Gracias a la familia.
Everybody.
Thank you.
Gracias to everyone. Thank you.
Take care.